Hello, my name is Dr. Robert Mahalich, and I wanted to provide you with an overview of what to expect when undergoing a fusion procedure in the foot or ankle. A fusion refers to the joining of two or more bones together in order to form one bone. When the bones are joined together across a joint, there is no longer a joint there. So this will eliminate arthritis from that joint and therefore eliminate the pain from that joint. This is referred to in medical terms as an arthrodesis. A fusion is done by removing any remaining cartilage from the joint and then preparing the joint surfaces by drilling to create a healing environment in that joint. The bones are then compressed together using plates, screws, staples, or a combination of all of them. Most commonly, fusions are performed in the foot and ankle to cure arthritis, but sometimes they are done to correct alignment or provide stability to an area of the foot. Like any other surgery, fusions are performed once all non-operative treatments have failed and the pain from the joint to be fused is affecting the patient's quality of life. Once a joint is fused, the motion in that joint will be lost. In most cases, by the time a patient gets to the point of having a fusion, the arthritis in the joint has already affected the motion in the joint significantly, so the change is not really noticeable. Prior to surgery, it is important to plan for your recovery so that the chance of complications are minimized and your return to function and work is smooth. The most important thing after surgery is wound healing. Therefore, it is imperative to be able to elevate the limb whenever you're not moving around. After surgery, you will be in a postoperative splint, which is like a cast but allows for swelling. You will not be able to remove it and should keep it dry while showering or bathing with a plastic bag or commercial cast cover. You will not be able to bear weight through the foot for 6 weeks to allow for proper healing of the fusion. This will require the use of a knee roller, crutches, walker, wheelchair, or some combination of all of them so that you may safely move about. Submitting any paperwork for disability, work notes, etc. ahead of time will help minimize the chance of any of your benefits being delayed. On the day of surgery, plan to arrive at the surgery center or hospital 1 to 2 hours prior to the surgery in order to get registered, changed, and do all the necessary preoperative processes. You will meet with anesthesia prior to surgery, and the type of anesthesia will be discussed. This is typically a general anesthesia using an LMA, which is a mask that goes in the back of your throat to deliver anesthetic gas, but the tube does not go all the way down into your trachea. This is less traumatic to the vocal cords and has less of a chance of a sore throat after surgery. For most fusion surgery, a nerve block that renders the leg numb for up to 24 hours is recommended to help control the acute pain of surgery. I will meet with you prior to surgery to mark the site, review the procedure, and answer any last-minute questions. Surgery typically lasts 60 to 120 minutes depending on the procedure and any additional surgery. Most patients are placed into a plaster splint after surgery, which is like a cast and cannot be removed. There are multiple areas that I will fuse in the foot and ankle to help patients eliminate their pain and improve their function. An ankle fusion involves fusing two bones, the tibia and the talus. This is usually done with a plate and screws. A subtalar fusion is fusion of the talus and calcaneus and is the joint just below the ankle joint. This is done with two screws and often in combination with another joint to correct flat foot deformity. That other joint fusion is a talonavicular fusion and is fusion of the talus and navicular, which are further down the foot toward the toes. This is also done with two screws. A tarsal-metatarsal fusion or midfoot fusion involves fusing the metatarsal to the cuneiform bones. There are 5 of these joints in the foot, and we will often fuse 2 or 3 of them. Screws and compression staples are used for these joints. Recovery after surgery is usually about 1 hour in the recovery room, and then most patients will go home if they are mobile and their pain is well controlled. Some fusion surgery is fairly extensive and may require an overnight stay for pain control and additional physical therapy. This will be discussed in the office prior to surgery, whether or not an overnight stay is necessary. All of these fusions will require the patient to be non-weight bearing for at least 4 to 6 weeks whenever walking. This involves using crutches, walkers, or knee rollers to move around. Placing the foot down for balance or to get up a stair or to get out of a chair or toilet is okay. We want you to avoid repetitively putting weight on the leg, however. Rest, elevation, and icing is key for pain relief and swelling control in the first 2 weeks after surgery. The most important thing during this time is wound healing, which is why elevation is emphasized. Most people will generally feel better with the limb elevated. You should keep the splint dry and intact until follow-up in 2 weeks. A plastic bag that is well sealed or commercial cast cover will be needed for bathing or showering. The cast bags are available in our office for purchase. At 2 weeks, you will return to the office for suture removal and x-rays. Most patients will be placed in a fiberglass cast at this visit and will continue to remain non-weight bearing. At 4 weeks, you will follow up for another visit and transition out of the cast. Most patients will be placed in a boot at this time, and this can be removed for sleeping, bathing, and icing. However, even though you are in a boot, most people will need to remain non-weight bearing for another 2 weeks for a total of 6 weeks from surgery. We will instruct you in how to begin weight bearing in the boot at this time. It is usually a gradual process and you will not be capable of bearing full weight immediately. At 8 weeks after surgery, another visit is done for x-rays now that you have been bearing weight, and we will discuss weaning out of the boot. This is also a gradual process and may require a wider or larger shoe to accommodate the swelling. PT is only used if you are having trouble with gait, balance, and functional mobility. We are trying to get the bones to fuse, so no therapy is necessary at the site of fusion. Swelling is expected and will take longer to resolve than anyone thinks. Compression socks can help at this time. The swelling can be present all the way up to a year after surgery and is not a cause for concern as long as your pain and function are improving. Additional visits will be made to monitor the progress of the fusion with x-rays to ensure it heals appropriately and that the goals of surgery have been met. Returning to work and activities is based on your ability to safely do your job or activity and to tolerate doing your job or activity. If you have a desk-type job and can get to work and maintain your non-weight-bearing status, you could return as soon as 2 weeks after surgery. For someone who has to be on their feet all day, return to work could take as much as 3 to 6 months. Good luck, and know that we will be there for you every step of the way.